coronavirus surges in almost half the states. For Michigan, are those green lights turning yellow? And the fight over mail-in voting in Michigan. The Secretary of State will defend her position, but will let one of her chief critics weigh in too. Today is Sunday, June 21st, 2020, and this is Flashpoint. Hi, welcome to Flashpoint. A very happy Father's Day, especially to one Colonel Bill Skillion down in Orlando, Florida. I've talked to my folks a lot this week. Florida is one of the many states watching a jump in coronavirus cases. In fact, just as many Americans were trying to put the virus in the rearview mirror, nearly 24 states hit their high marks going all the way back to the start of the pandemic crisis. From the reopening of businesses, especially restaurants and bars, to the scenes of protesters all over the country, often with no mask and seemingly no thought of social distancing. Some would say the virus surge is about the least surprising thing we could see. And we're reminded that right now, wherever you go, you're going to be at the mercy of the dumbest, most clueless person in the room. Now, Michigan has been getting a fair amount of applause. A British study this week found that the state's stay-at-home order saved perhaps tens of thousands of lives in our state. And yet, we still are faced with a fatality rate that is the highest in the country. What can explain that? And what has it taught us should we see a resurgence here? Coming up, we're going to talk with the state's medical director, Dr. Janae Caldoun. A little later on, we're going to dig into the ballot battle in Michigan. Can we, should we, must we vote by mail? It's all today on Flashpoint. All right, let's start this morning by turning our attention back to our worldwide public health emergency, and right now it remains exactly that, despite what feels like some folks letting off the brake. Let's talk about it with the state's top medical officer. Back with us again on Flashpoint, Dr. Janae Caldoun. Doctor, appreciate the time. You are, of course, paid to worry, but I'm really curious as to where your concern level is. As Michigan got some good report cards on the way that we've handled the science so far this past week. And now we are trying to reopen, and yet you watch what's happening around us in so many other states. Not really a second wave, but the continuation of the first wave. Where's your concern level today?
Right. So I'm cautiously optimistic. I think that the state and the people across the state have done a really good job as far as being safe, making good decisions, wearing masks, washing their hands. And that's why you see Michigan's numbers where they are today. But I certainly am concerned. I'm looking at what's happening across the country. I know some states have reopened while their cases were still kind of trending upwards, which is not something we've done in Michigan. But I think it's going to be important for people to continue to take this seriously.
I want to get to the statistic that continues to vex a lot of the state's doctors and scientists, and I know it's one that's vexed you. The fatality rate in Michigan seems to be somewhere between 9 and 10% of the people who have gotten this virus have ended up dying from it, which is about 10 times higher than we see it in most other places. Have we been able to come up with an explanation for why it's so much higher, so much deadlier in our state?
So I think when you talk about the case fatality rate, that's really dependent on the people who are getting tested. So it's the number of people who died out of the people who were tested. I think, unfortunately, what the national story is going to be when we look back on our response is that we did not get testing out the door quickly enough or robustly enough. And quite frankly, I don't know that we ever will, as a country, be able to test sufficiently. So I do believe that that case fatality rate is probably a little bit lower. There are plenty of people who are asymptomatic or who have mild symptoms or who have not gotten tested. But we will continue to monitor, and certainly there's no question this is absolutely a very deadly disease, particularly for those who have chronic medical conditions or who are older.
But the lower numbers, the lower fatality rate, you would think would be true everywhere because testing has been a problem all over the place. So I guess the good news is you would expect the fatality rate is lower than we expect because so many more people have had the disease. But even though I understand that Michigan had a very intense experience with this very early, before we understood protocols, it still doesn't quite seem to square. And I wonder, are we counting differently than the rest of the country?
I certainly can't speak about every state and what they are doing, but we have done a great job as far as counting our deaths to make sure, again, we have an accurate view of deaths related to COVID-19. So we cross-check our database as far as positive lab tests and people who have died. And of course, we also look at our death certificates. That is best practice. We've gotten a lot of great feedback from our CDC colleagues about doing it in that way. But that is how we're doing it here in Michigan.
I want to get to the way we treat this disease then, because it seems to me if we do have, and this is a theory of my wife Corey's actually, if we do have a vaccine that is still a long, long way away, a cure is not really on the landscape right now, then what we're going to need to do is come up with ways of making this a less deadly disease and one that that we can treat with more efficacy. Are we getting better at treating the disease as we've gone along?
Well, I know there are many studies that are coming out about different medications, and perhaps they may have some efficacy. But I'll tell you, the most important thing we can all do, and really that's for any infectious disease, is prevention. And there is a way to prevent people from getting COVID-19. Yeah. That is social distancing, washing hands, all the things we've been talking about. So that continues to be the strongest tool we have in the toolbox right now, and it's why it's so important that people continue to adhere to these recommendations.
Well, you're like everyone else. I imagine you go out and you see people that are sort of baffling to you in the way that they behave out in public, but somehow the mask has become politicized, which is not a great place to be, is it?
Yeah, I just make public health recommendations. It's not a political thing. It's a way to protect people from getting sick, and it's a way to save lives. So it's unfortunate what's transpired across our country with making masks political. It absolutely is not. It's just a matter of public health.
I want to get to an issue now that I and many others have struggled to understand, and that's the nursing home issue in Michigan, where about a third of the deaths in our state have occurred. Putting patients with COVID who are somewhere between hospital and home convalescence into nursing homes where the most vulnerable population already lives is very strange to many people. And it seems to me like it's a little bit like saying, I don't know what to do with this boa constrictor, so I'm going to put it in the nursery with the babies until I can figure it out. Why does that continue to be, because some other states have dropped that as a policy, why do we still think that that's a good idea?
Yeah, so I don't think anyone is pleased with what's happened as far as the people who are dying in nursing homes. But I'll tell you, I don't know that other states have necessarily figured it out. If you look at national numbers, it's similar as far as the number of cases and deaths in nursing facilities. So I think it's something we're all really struggling with. I can tell you that we did not actually mandate that any nursing home take any residents that they did not feel comfortable with taking when it comes to staffing or PPE. But we continue to just really work hard, and we take this very seriously. Earlier this week, we actually issued a mandate so that all nursing homes now have to test their staff and their residents to make sure that we're keeping those residents as safe as possible. And that's in addition to other things we've already done, regional hubs, so safe places for residents to go, working on staffing support for those nursing homes. And we've reached out to over 300 nursing facilities to provide technical assistance, working with the CDC as well to make sure they are implementing best practices.
I've had a lot of people ask me, though, we never saw a whole lot of patients needing the space at TCF Center, Old Cobo, or Suburban Showplace that were set up as these field hospitals. Why weren't those a better idea for these people who were somewhere sort of in the middle of needing intense care and yet not being able to go home?
I'll say it's actually a good thing that we did not need to use those facilities. Where we were looking in the beginning of April, when we first were starting to see the surge in cases, we thought that our hospitals would be overwhelmed and we would need all of the space that we planned for. So again, because of all the work that Michiganders did, we did need to use that space. I can tell you, we talked to a lot of our colleagues and our partners who oversee nursing homes, and these spaces, we want to make sure people are in a safe place. So the two alternate care facilities were not actually set up from a space perspective or staffing perspective to be able to give high quality care to nursing home residents. And so that's specifically why we did not use those facilities. Someone would have had to go and walk to the bathroom, for example. We did not have the direct care staff that a lot of, especially someone who's bedbound, a lot of the supports that a nursing home resident would need. And so we don't want to cut corners when it comes to quality of care for patients. And so that is why we were unable to use those facilities.
Lastly, let's get to schools, which was a lot of the big talk this past week from the governor. What are your biggest concerns now with trying to get kids back into school? And is that a wise idea at all? We understand that kids may not be as susceptible to the disease, but we also understand they can act as carrier pigeons, taking it back and forth between households.
Right. So I also have 3 school-age children, and I certainly understand the importance of wanting to provide our children with a quality education. And quite frankly, parents have to be able to work, go back to work, and have a place to send their children. So I think it's going to be important. I'm working very closely with our stakeholders across the state to be able to come up with a plan that really keeps everyone safe, implements the best practices. And of course, if we see that there's any concerns, there's an uptick in cases, we can always pivot. And there may be places where schools have to close for a period of time. But I do think it's important that we think through how we can continue to educate our children in the best way possible.
Staying agile here does seem key. Dr. Khaldun, I know you're somehow operating on 30-hour days. I appreciate you giving us the time, and stay well.
Oh, thank you for having me. Stay well.
You bet. When we come back, we'll talk about the hot issue of mail-in voting in Michigan. This is Flashpoint on Local 4.